Today's video is going to be on health anxiety and trust issues. Please excuse the wire coming from my ear. I'm trying out a different microphone to see if it's any better quality or louder than using my mobile phone. Hopefully it will be improved. Okay, so if you have health anxiety, I would say it's probably more than likely that you suffer from ongoing trust issues. And when I say trust issues, I'm talking a lack of trust in the doctor or anybody medical, a lack of trust in therapists, a lack of trust in your own memory, a lack of trust in your body, and a lack of trust in, well, I would say pretty much everything that you could potentially trust, you probably have lost trust in. Okay, and I think part of the reason that I found that happens is because the fact that we have a very active imagination, and we tend to get confused between fact and fiction. That makes us distrust anything that could potentially reassure us, simply because we're not entirely sure that it's true. So I would imagine probably most of you established your lack of trust in the earlier days of your health anxiety, probably around the time you went for your first set of doctor's appointments, and they were probably numerous. I would imagine most of us go through numerous tests in the beginning, and as a result of those tests you were probably given findings and they all said that there was nothing wrong. Maybe you went to see your GP numerous times and your GP told you it was just anxiety, which they all say to you, and as a result of that you don't trust the doctor anymore because the doctor didn't explain how it could be anxiety causing symptoms. So I think that early mistrust then goes on to infiltrate your relationships with your family, because your family don't suffer from health anxiety disorder, so they see your reactions as being irrational, which they are, and because of that they don't have any understanding of what you're going through in terms of misinterpretation of symptoms. So to them you're irrational, and the more you ask for reassurance the more infuriated they get, and the easy answer for most of them to give you is you're fine, there's nothing wrong with you. And knowing that there's no medical basis for those comments makes you trust them less. And this can just keep on going with everything. You lose trust in your capabilities. You don't know whether you can do things anymore. You don't know whether you can eat certain foods. You don't know whether you can go to certain places in case something happens to you. So these are my tips to try and help you not regain trust, but use a different method that will save you having to rely on trust and memory. Okay. So what I would suggest is when you go for a doctor's appointment, what usually happens is you're given some kind of a test, you're called back for an appointment to talk through the results, you go in to listen to the results and be told about what is or isn't wrong. Usually there's nothing wrong, and you are already in a state of anxiety, and you listen to the information, and when you get home you seem fine and you're reassured, and then probably, I'd say probably about a week afterwards, you know, the honeymoon period where everything's fine, I'd say probably a week afterwards, you start to question whether or not the doctor was being honest with you, and perhaps he knew something that he didn't want to tell you, whether or not the tests were sufficient, whether or not the doctor actually cared enough to look into the symptoms you're experiencing. And a lot of the time we selectively remember pieces of information out of context. So one sentence that they could say to you tends to, in your mind, invalidate all of the results you've been given. And then you rely on that piece of information rather than the actual results because you don't remember the results. So with doctors, the easiest way to deal with this is to, when you get your results, ask the doctor to print them out for you. And then you can actually take them back and have a look at them and understand that the tests have been taken and they were sufficient. The doctors are usually quite good with giving out copies of your medical tests. Obviously, they're initially a little bit apprehensive because they think, why do you not trust me? And they don't want to give you results. But usually if you explain to them that you suffer from health anxiety and you tend to mistrust information if you're not given a hard copy for you to refer to, they're usually more than happy to print them out for you, because in the long run it actually saves them having to keep on seeing you with paranoia. Okay, so if you keep a medical file for yourself that contains all of the tests you've done, say a year or two down the line, if you're freaking out thinking, oh my god, I ought to have had a B12 blood test, you can refer to your tests and see that you've already had it taken. Or if you develop a fear that you might have kidney failure, you can refer back to your blood tests and see that you had your kidney tested only 6 months ago and there was nothing wrong with it. So it makes that more reliable. And there are also other things that the same technique can be applied to. Some of us, well, speaking for myself really, I know that I developed a fear of a lot of foods, and I became scared in case I went into anaphylactic shock. So I started logging a food diary, but it wasn't just a food diary, it was actually a list of all the foods that I know that I've eaten with no problems. So if I go somewhere and there's something I haven't eaten before, sometimes it's not a case that I haven't eaten them before, it's just I don't remember that I've eaten them before. So if I can refer to that list, then I know that I've eaten those things and I don't feel afraid. The same goes for medications. I have a severe medication phobia. So with medication phobia, you could be given medication and then 6 months later you have a chest infection and they give you the same medication but you don't remember the medication, or it might have a different brand name, so you become afraid to take it and then you don't get better because you're not taking your medication. Things like antibiotics, they're always one. And what I used to do, I don't do this so much anymore because I don't need to, because I've relearned to trust. But I would keep copies of I would keep the boxes that the medication came in, so that further down the line, if I was prescribed a medication, I would think back and think, well, have I taken that before? And I'd be able to refer back to the boxes. And that means that you can take the medication without being fearful of it, because you know that you've taken it before and you've had no side effects or anything. Another thing that I use it for, this is something specialist to me because I've had this fear for about 10 years of my hair falling out for no apparent reason, but it's there. So what I do is I save all of the lids of the hair dyes that I've used, so that if I want to dye my hair, because my hair is going very grey, if I want to dye my hair, I can refer to the packets and see which ones I've used so that I know that I won't have a chemical reaction to them. And the beauty of using this process with most things is the fact that you develop a safe list almost, or safe information, and then sometimes when you have courage, you can actually experiment on things that are outside of that list and then add new things to it. So you might be told that you've got a chest infection and given an antibiotic at one point that you haven't taken before, but because you're feeling comfortable at that time and not too anxious, you have the courage to take it, and in doing that you can add an extra thing to that list of things you know are safe for you. And I would say this is the best process that I've found for not having to rely on memory and trust. The whole thing about trusting friends and family is a separate issue, because that's actually a reassurance issue, and to a certain degree that applies to doctor's appointments as well. And that would be a separate video at some point, because that's to do with the reassurance loop that stops you from having the ability to trust. But for the smaller things, when it's just a matter of trusting information, I would say that keeping documentation and evidence of things that you've done in the past that might crop up in the future can be helpful. There's other things as well, which are an extra tip that I just thought of as well. We tend to start panicking over things that we know that we've had for a long time, but we will irrationally panic about it. So things on our bodies that we know we've had for a long time, we can start to worry about and think, has it changed? For example, just off the top of my head, I have it's almost like a birthmark on my face. I could easily one day just start panicking and thinking, is that skin cancer? Which I know it isn't, because I've had it, probably for 20 years, but that doesn't change health anxiety reacting to things. And in that kind of situation, what I found really helpful 10 years ago, when I was in the thick of my health anxiety, was to keep recordings of physical attributes that could be something that you'll worry about in the future. So what I did at the time is I would take a picture of it and put a date on it, so that say 5 years down the line I developed a fear that there was something wrong with it, I could look at it and see that it has not changed at all in the last 5 years, and that would put my mind at rest. So you can do that for a lot of things on your body. I wouldn't go full OCD with it and start recording everything, but things that are, strange anomalies, things that appear to have no cause but have been there all the time, they're good to record, simply because you know very well that at some point you'll start freaking out about it, even though you've had it for a long time. That won't stop you. You'll still freak out about something. You hit a trigger and then you connect it to something on your body that may have been there for a long time, and you'll go into full panic. However, if you've got some kind of a reference, that won't happen, because you can refer to your old material. So I hope that's helpful to somebody. I wouldn't go looking for problems necessarily, but this might be a good way to learn to trust information over memory, and I think that might give some of you quite a lot of relief. So if anybody wants any more of my pointless tips on how to deal with health anxiety, by all means comment below, and anything that you would like me to talk about from my own experiences on how to deal with certain elements of health anxiety, I'm more than happy to do. Just pop a message in the comments, or alternatively send me a message. Okay, so I hope you all have a lovely day, and I will speak to you next time. Okay, bye bye.